for the Center for Christian Virtue. Thank you so much for jumping on this very important call. Want to welcome all those who have jumped on. We've invited members of course, the state legislature, but also the Attorney General's office, the governor's office, also many members of the law enforcement and prevention communities across the state will be joining us on this call. And then this call will be recorded and made available to those who were unable to be on. We didn't want to invite too many folks from the general public for this one, but they will be able to see the video. It will be posted at CCV, on the CCV website. Again, we will be recording the call. We have Kevin Sabet with us. We've got Dr. Finn will be joining us shortly. But it's important that we not only hear from Ohio regarding marijuana policy, whether it be medical marijuana or recreational marijuana. It's important that we hear from Ohio, and really we've got several fraternal order of police have come out in opposition. Ohio Association of Chief of Police have come out in opposition to the expansion of our medical marijuana program. Buckeye State Sheriff's Association, Tuscarawas County Sheriff's Department, Prosecuting Attorneys Association, and then multiple hospitals, Cleveland Clinic, Nationwide Children's Hospital, Mercy Hospitals, Trinity Health, University Hospitals. All these have policies prohibiting the prescribing of medical marijuana for one reason or another. But it is important also to look outside of the state of Ohio. We are babies in this, and there are many states that have gone before us. One of which is Colorado. And so being able to hear from the perspective and the wisdom and experience from Colorado is key, because they lead the nation in marijuana policy. And with us today, who will be speaking first, is Kevin Sabet, President and CEO of Smart Approaches to Marijuana, PhD, but former drug policy advisor for Presidents Obama, Clinton, and George W. He will be just kind of sharing on some of the policy ramifications of both medical and recreational marijuana. Kevin, thank you so much for joining us. I'll go ahead and turn it over to you.
Great. Well, thanks so much, David. Thank you for having me. And I want to thank all of you for being on today. And I hope to, give a presentation and answer some questions, because this is obviously a very thorny issue. I served in multiple administrations. I understand the politics. I understand the policy. It's not easy. So no one is pretending that it is. And there are a lot of thorny issues, to say the least. So if you can see my my PowerPoint, I'll go ahead and start. Just a little bit of background on me. I'm an affiliate at Yale University. I served in a few different administrations for both Republicans and Democrats. I founded a group called SAM, Smart Approaches to Marijuana, which was co-founded with former Congressman Patrick Kennedy. And I've been studying this issue for 25 years in all kinds of different venues, really looking and dissecting the research in the best interest of public health and safety. And in full disclosure, I have no financial conflicts. And I think that's a really important question, by the way, when you have people present and you have people talk and testify, to ask what their financial conflicts are. Are they in the business? Do they have backers and investors from the marijuana industry? I mean, that's really key, because unfortunately, we've seen policy being written by folks that have a financial interest in pursuing this. Our donors at SAM are all disclosed. They're all basically individuals who have had really unfortunate struggles with substance abuse, either themselves or family members. And so they've decided to give back, and that's really how we're supported. We promote an evidence-based approach. This is not fear-mongering. This is science-based. It's public health-based. It's public safety-based. And it's really going against this dichotomy that is often presented, that you either need to criminalize people or you need to legalize drugs. We actually reject that false dichotomy. And we work with, by the way, multiple medical associations and other groups, law enforcement around the country. So my quick outline, I'm going to first talk about marijuana medically generally, then talk about state experiences, regulatory fails, talk about the opioid issue, because we really can't forget that, and then make some conclusions. So first of all, it is important to understand that there are three separate issues that often get conflated. Decriminalization is not medical marijuana, is not legalization. They're three different things. We can talk about the three different things if you'd like. I'm going to talk a lot about number two, medical. But of course, within the medical basket, there are many variations, right? There's legitimate marijuana components used for medicine that I think are legitimate. They have passed FDA muster. And then there's illegitimate. There's products put out there, not tested, other than by the state. But of course, as you know, in Ohio and in every state across the country, we don't have state FDAs. So we rely on the Food and Drug Administration. Ohio is not going to approve a COVID vaccine that Pennsylvania isn't going to approve. You're not set up to do that. That's for the FDA. But unfortunately, a lot of times with medical, we have totally gone around the FDA. So we'll talk about that a little bit as well. So is marijuana medicine? I just want to start with that question. And the reality is that, the answer is yes, no, and maybe. Smoked marijuana is not medicine. That's we need to be very clear about that. Ingested raw marijuana has not passed the medical muster. There are marijuana-based pills available, though, and other kinds of medications that are available or will be available soon. And the bigger question is maybe. There's a lot of ongoing research, so we need to look into it. We need to see what makes sense. That's something we have to be, of course, open to. Marijuana is a Schedule I drug, and there's a lot of misconceptions around that, folks. People think because it's Schedule I, we treat it like heroin or something, because heroin's also Schedule I. That's not correct. It's clearly a classification. It is not a harm index. It is not an index equivocalizing marijuana with those other drugs. It simply means that it is not approved for medical use. But you can research it. It is being researched. We think there should be more research. And right now we have about 3 products, the first 3 that are fully FDA approved. And then the 4th one that's going through the process, but actually it's been failing a lot of the trials. So it may not pass muster by the FDA, but we do have Marinol and its generics already available at a pharmacy today, which is synthetic THC. We have Sesamet, which is another synthetic THC analog in Schedule II. And then the newest one is Epidiolex, which is cannabidiol or pure CBD oil used to treat very complex disorders related to seizures. Of course, as you know, you can buy CBD, things that are labeled CBD everywhere because the Farm Bill passed. So we have CBD derived from hemp. But what I would say about that is that's not gone through the FDA process. It's gone through a political process. And I will also say that it is very much buyer beware. You don't know what's in those products. And in fact, when we test those products, we find a lot of adulterants, molds, bacteria, spores, etc. So you don't really know what you're getting unless you're getting the pure Epidiolex, which is approved by the FDA. And it's approved for, different kinds of epileptic syndromes. There's other products in development like synthetic CBD that Incest is doing. Hasn't been doing well in some trials. It's been doing better in others. This is going through the process, and that this is what the FDA process is. What can't medical marijuana do? Well, we hear a lot of things that it can do, but it really can't do it. It should not be used for depression. It should not be said that it cures cancer. Instead, what it does is it helps with the side effects related to some of the nausea related to the medications. Lists of things put out by medical authorities saying that really it cannot do this, even though the marijuana industry, it says that it goes and that it can cure brain cancer, it can cure headaches, writer's cramp. We've heard all kinds of things from the media about what it can do, but in reality, it can make these things a lot worse. As mentioned, there are approved medicines that exist right now that is very different than what we are seeing that marijuana should be approved for in Ohio and other states. I'm not going to expound through some of these federal solutions, but we are advocating for a longer term solution for more medical risk research. But it's really important to understand that the average user of a marijuana card in Ohio and other states, they're not really sick. The average user is a 32-year-old white male, no history of life-threatening disease. They use it as a cover. I mean, that's just the reality, folks. If we were talking about, people with 6 months to live, that were the majority, then maybe we would have another conversation, because I do believe in the right to try. I do believe that if you have months to live, you should be able to try anything. But folks, that's not really what this latest legislation is about. What happens when a state legalizes? Well, it's very interesting. There is a cycle of what you might call tax and regulate, where medical marijuana is legalized, becomes a cover for the black market. There's more supply, prices plummet. The black market, by the way, undercuts the price. So the black market is thriving. You have adulterated products, as we've been seeing with fentanyl, very relaxed taxes and regulations, more locations, and finally, recreational marijuana legalization. This is a cover for full legalization. So when you start loosening the medical regulations, you see what this cycle is truly, truly about. I mean, in Oklahoma, medical marijuana passed on June 26th, and 2 days later, the same group announced a recreational ballot initiative. So it's clear that this is really what a cover, and it is a cover in Ohio. We've seen the effort to legitimize marijuana in Ohio, to recreational, legalize, and commercialize. Of course, that effort failed, thankfully, in my mind, in 2015. But they are doing that. Of course, they're coming back, and the reality is, the tax revenue versus reality. I have seen a report by a pro-legalization Coke Industries funded. Remember, Coke Industries, they want to legalize drugs, libertarians. And the Coke Industries funded report found that they said, oh, we're getting all this tax revenue, $375 million eventually after year 5 here, using higher prices. But what happens in other states? Well, in other states, we actually need to really look at what it does. And what it does is that for every dollar in tax revenue, one study found in Colorado, we spent $4.50 mitigating the effects of legalization. Look at California. They were promised $1 billion. Right now, the estimated numbers are far less than promised. In the red, it is less than, by the way, let me just say this, less than 0.1% of tax revenue in most of these states. I think Nevada might have hit 1%, just because of how they're promoting it. But this is not an answer to budgets. And that's really important to understand, is that this is not going to be filling really any budget holes. We also have seen that marijuana stores lead to increased youth use. Youth use in Oregon has increased in counties with more medical marijuana dispensaries. This is peer-reviewed research done by researchers without any conflicts. There was a leaked Oregon State Police report from a few years back that found that most of the medical marijuana was being diverted to the illegal market. So the point is that we're seeing leaking to the illegal black market, leaking to youth use, and more crime. We had an NIH-funded study recently, crime in Denver, increasing where you have marijuana stores. And, folks, this is why the marijuana stores aren't appearing in the, I have relatives in, for example, in, Chagrin Falls. And let me tell you something, they're not going to be getting any pot shops anytime soon. Let's be honest about where the marijuana stores are congregating. They're congregating, and they want to congregate in poorer communities of color, where there is more likelihood to accelerate into addiction because there are fewer resources. Addiction is not only biological, it's behavioral, it's environmental. It matters about who's around you. What does family life look like? What does treatment availability look like? What does housing, healthcare, education look like? So these industries target those areas where you don't have as many resources. Why is there, payday free loans, the tobacco outlets, lottery, gambling? This is all congregated in poorer communities. And now we've seen that also increases crime. By the way, it doesn't reduce alcohol consumption at all. We've looked at all that research. They thought it would do that. We also have seen the impaired driving. There are multiple studies. This one just came out, but there are many, many more showing impaired driving fatalities have more than doubled in these areas where you have opened up medical and recreational. And in Colorado, marijuana is now the #1 crime and offense in public school. So, again, I'm not very surprised, that we've seen that. We've predicted it, because young people are getting the message that this is A-OK. Daily marijuana use is rising in youth and young adults. I won't go through all the data. I'll make sure that you have this PowerPoint. David has it. You can all get a copy if you'd like. We've seen a very bad effect on college students in terms of the increase in new workers. I'm gonna keep going. The National Academy of Sciences talking about mental health. We cannot talk about marijuana and ignore the mental health, psychosis, schizophrenia issues that are happening in our young people, and really in everybody. We've seen the suicide level increase with known THC in their system. We've seen these products get to young people, these edibles that are being brought to school. Of course, we've already seen that, but imagine how and this is just from yesterday, in the Columbus Dispatch. in Upper Arlington. But we've seen this all across the country, and we're going to continue to see it even more if we loosen these rules. What are the current regulatory failures? Well, folks, let's be honest. Right now, the illegal market is thriving. There's increased access for minors. There's pesticides and contaminants. If you test what's out there, which we have done, the pesticides and contaminants are off the charts. And we're even seeing the marijuana industry trying to recommend this for pregnant women. But we have seen when you open up the marijuana industry, how it opens it up to foreign cartels. I mean, California and New York, it's just been getting so much worse since they've opened up medical and legalized outright. I mean, this is what the data is showing. Here's a headline: Mexican drug cartels taking full advantage of Colorado's marijuana law. I mean, this isn't going to be any different in Ohio if this happens. You hear law enforcement talk about the grows, talk about how, this is not being regulated. This is all being illegal. There is really no way to track this. You're going to have fancy pot companies come to you and say that they can track it from seed to sale. No, they can't. It has tons of loopholes. This is salesmen speak when they say this. It is really not the reality at all. Sales to minors.
If I could jump in real quick, Kevin, I forgot to mention, if you have questions, please drop those in the chat. We would, Kevin will probably have time for about 4, maybe 5 questions before he has to drop off, and we have another speaker to touch on more of the medical side of things right afterwards. But yeah, if you do have a question, and I know many of you do, many of the questions that came up during the hearings, I've forwarded to both Kevin and Dr. Finn. But if you do have questions, please drop them in the chat. Sorry to interrupt. Please continue.
Yeah, no problem. So sales to minors, we've seen increase, which is obviously a big issue. Marijuana stores being busted for selling to kids. I mean, this is all happening everywhere. The gummies, the candies, the edibles. Why do we need 99% THC? I mean, this isn't your Woodstock weed anymore, right? This isn't the 5%. Well, you need it if you're an industry, because that's how you make money. And yet we've seen states fail to regulate pesticide use, contaminants, as I was saying. There has been so many recalls. I mean, this is just from 2018, but we could go later. I mean, that we don't have time to count all of the recalls, and they're not publicized, by the way. You have to go find them on a footnote on the state website. We've seen how these dispensaries, when they really have very little regulation medically, they start recommending to very vulnerable populations like pregnant women. A study found 70% of marijuana dispensaries in Colorado recommended these products to pregnant women. And we know that that is a very, very bad thing for the developing fetus and for women. We've seen how THC can really be a detrimental, tied to all sorts of negative cognitive defects. Also, in this opioid epidemic, why would we talk about marijuana? Well, the reality is marijuana companies say things like this, that there are fewer opioid-related deaths. What they forget to tell you is that a lot of these studies are not good, and they've been updated since, finding that they disconfirm the hypothesis that medical marijuana means that few people use opioids. Actually, we find that marijuana and opioids often go together. It is not a substitute for the majority of people when you look at these studies. In fact, look at the overdoses in Colorado. They've skyrocketed since they've legalized. So it has not been a substitute at all. In fact, 92% of people using heroin used marijuana first. So we really need to understand, by the way, the industry is fully involved. I mean, you have the former OxyContin CEO now selling quote unquote medical marijuana. So we know how Ohio suffered because of Purdue Pharma. Why in the world would you write rules and laws that would allow someone like this guy to come in under a different guise, right? Under a different company. And guys like him. So I'm very concerned about that. The reality is states are not effectively regulating medical marijuana now. No state has successfully put a limit on potency, and increased marijuana access and use is harming those who need help and who want to recover from opioid addiction. I mean, this is why every medical society in the country has cautioned states from opening up marijuana to the use for opioid addiction. They said this is not the right thing at all. And really, no matter how much you oppose recreational marijuana, once you allow them in, they will keep trying to increase their market share, grow their customer base, and increase customer use. That's the name of the game. This is for profit. This is to make money. You don't make money if people are being responsible. So, I do think I want to end with the final quote from really the head of the NIH Institute on Drugs, Nora Volkow, who said, repeated marijuana use during adolescence may result in long-lasting changes in brain function that can jeopardize educational and professional and social achievements. However, the effects of a drug on individual health are determined not only by its pharmacologic properties, okay? It's not only by the properties of the drug, but also by its availability and its social acceptability. In this respect, legal drugs offer a sobering perspective, accounting for the greatest burden of disease associated with drugs, not because they are more dangerous than illegal drugs, but because their legal status allows for more widespread exposure. When you allow and loosen up rules, you allow more exposure, and therefore the drug becomes more harmful. The drug is not just harmful because of its pharmacologic biological properties. That's the real key that we have to understand when we are putting together, new rules and regulations. So you can go to our website, which is learnaboutsam.org. And in fact, if you don't mind, I'm going to take you to that website right now to navigate, since I have a few minutes, if you don't mind, David. I'm going to take you to the website. Here we go. And you can see there's all kinds of things, stories of victims. This is actually an Ohio mom who lost her daughter in Ohio because he had a medical marijuana card and ended up driving and killing her. She was 19 years old. And then you can go here, facts and resources. If you want to learn more about medical marijuana or any other thing, you go to toolkits. And in the toolkits, there are just tons of one-pagers, quick facts, dispensaries and crime, marijuana and the opioid epidemic, the need for marijuana and THC caps. We need to cap THC, even in the medical side. We should not have 90% THC. Medical marijuana medicine or marketing scheme. So you can learn a lot more, about what the marijuana industry is doing. Legalizing and taxing won't solve budget issues. Here's the tax revenue, by the way. Look at the state tax revenue numbers. This is the percent of budget that is brought in from marijuana. I mean, it's a drop in the bucket. We need to understand that. Affect youth use. What's going on in terms of the developing brain? How has it affected Colorado? I mean, we can go on and on. Social justice. The movement is a Band-Aid. It is not social justice. And then the link between marijuana and other drug use, et cetera, road safety, all kinds of downloadable resources for you. We want to be a resource for you, and we want to be able to be helpful. So I'm very happy. I wanted to breeze through that quickly because I'm very happy to get into a discussion, take any questions. I'm very open to any questions or comments, concerns you might have, and then we can go from there.
Man, thank you so much, Kevin. Appreciate your perspective and breaking everything down so well. I know there are no questions in the chat so far, and we do have another presenter coming on here probably about 1:40 or so to speak to the medical side of this. Dr. Ken Finn, president of American Pain Management Board. I would just start us off with a question regarding THC. The current standing for Ohio's medical bill is, I think it has a cap of 70% THC, which is high. From what I understand,
very high.
For any medical use, maybe 5 to 15% THC. And then in this version 261, they're wanting to expand the potency to 90% THC. I've not heard a good answer for why. The industry says that it's got to do with the process of making the batches, right? So they don't have to throw away as much. If they start high, you get a more pure product. Would you have any kind of, could you speak into that a little bit?
One thing I can tell you is that First of all, the 70% THC products that you have there, I guarantee you, are not really 70%. I guarantee you they're more THC or less, frankly. There's the science of gauging the THC, I can promise you, no state has perfected that. So I would first of all say that. But secondly, 70% is very high. Woodstock weed was 5%, and that got a lot of people high. The concentrates start around 40 to 50%, and that is very high. I mean, this is an order of magnitude difference from the past. To go from 70 to 90 is just, you're doing it because the industry wants more products. There's no medical reason to do it at all. In fact, there's been a lot of studies showing that for medical marijuana, these higher potencies are really harmful. And I think Dr. Finn will talk about that. So there's really no medical justification. The justification is really pure profit motive.
Thank you. I do see Representative Gross has a hand up. Please go ahead.
Hi, guys. Thank you so much. Can you hear me?
Yes, I can.
Okay. Thank you, sir, for being here. I really appreciate it. I've been in really close contact with Tanya Van Beber, who's a Colorado House rep, and she says that this has absolutely turned Colorado upside down and that they're creating new products, something, I don't know, something that's even like more than 90% and that it's everywhere and you buy it. But I am the only clinician in the caucus. I'm just a nurse practitioner.
Right.
And I'm really concerned about what I'm seeing and sometimes hearing in the medical community that, marijuana was removed. It was once legal. It was just made illegal in the 70s. And that there are medicinal purposes. I'm very familiar with Marinol and those kinds of things. Of course, I've never used it, not even as a clinician. But it's so confusing about, where is there a balance? Because Tanya tells me that in Colorado, it's laced with fentanyl. I've even got a constituent whose daughter died of a fentanyl overdose, and he believes marijuana ought to be legalized and you just can't, it's coming at all sides. And I guess the only answer is do not pass this bill because, when I see children on 240 milligrams of Haldol and a severely autistic nurse, that a child and a nurse is telling me, hey, I would try anything and I'm willing to try medical marijuana.
Mm-hmm.
I agree with her. I mean, that Haldol's damaging to a juvenile brain, but so is marijuana. But I got to tell you, I was leaning toward this bill till right now. And I'm even talking to Tanya, but it's so hard because they say we got to pass this because Ohio is going to legalize it anyway. So if the people put it on the ballot, it's going to be legalized. I mean, I don't know where we go from here. So.
Well, it's a very difficult. Well, thank you, Representative Gross. I mean, it's a very difficult conundrum. Listen, with somebody that has, is in dire straits with months to live, they want to try anything. I like I said, I'm not against that. The problem is when you loosen this up, it's not about medical, it's more about recreational. And even if you do legalize it recreationally, and if it does become on the ballot, I think it's going to be very interesting. I mean, politically, I don't think it's a slam dunk. Listen, they're going to put a lot of money in it. They need Ohio because it was so embarrassing when they lost that one, 2-1 last time. And so they really are going to put, when I say they, I mean the marijuana industry and the billionaires that are funding all of this advocacy. They will put a lot of money into Ohio to pass legalization. And so they have a very good chance of doing so. Even if they do pass it, I think it's a legislature's responsibility to be responsible with what you all can control. You can't control what the voters are going to do. And if they're going to do that and go against federal law, well, then you can help write the rules and try and make it as good as you can and not have it be, no advertising, full advertising, and all this other stuff that's causing problems in other states. You can do that, but you can only control what you can control. And now you have this in front of you, which I think really is going to expand this in a way that is going to be abused and has been abused in every other state. So on its own merit, I think you have to look at it. The other question was about the momentum for federal legalization. and medical marijuana. I can tell you, we have a president right now who's against the legalization of marijuana. That's President Biden. We have a Senate that is divided. We have about 6 or 7 Democrats in the Senate who don't want to see marijuana legalization, and maybe only 1 Republican that does. So they can't get to 50, let alone 60 in the Senate. We have a House that'll probably look different in November. So we're going to change those votes. Already with the current Democratic controlled House, legalization barely passed by about 10 votes. That'll change. So, people say, well, this is inevitable. It's going to happen to the federal government. I mean, they've been saying that for 15 years. I had a bet with an academic once in 2008, and he said, Kevin, marijuana will be legalized federally in 6 years, which is just in time for the second term of Hillary Clinton's presidency. And so, that was in 2008, right? So people have been making these predictions for 30 years. And right now there's no momentum. But Representative Gross, you also asked about the history. Don't get me started on history. I love talking drug policy history. Marijuana was banned in the United States in the early to mid part of the 20th century because actually Mexico banned it first because of the negative effects. And then you had America ban it after Mexico did, which is interesting. A lot of people think America banned it because of anti-Mexican sentiment and Mexico was all in favor of marijuana. Actually not. Mexico banned it first. Then we saw the negative effects. Does that mean that we never had exaggerations? No, of course we did. There was the reefer madness era. There was the exaggerations of the 30s. There was the racist policies. I'm not saying that didn't exist. I'm not acknowledging that at all. I'm not acknowledging that at all. What I'm saying is right now, when, we can't go back to 1914. Right now, when you look at the data, when you look at what's going on, when you look at legislation like this, I think, you see that there is plenty of justification to actually get stricter, not looser, on something that has absolutely no approval and is going to be taken advantage by this industry. I think that's the way we have to really look at it.
Thank you very much.
Thank you, Representative.
Awesome. I do see a question. SB 261, which expands medical marijuana program, allows certified physicians to be able to recommend marijuana for any condition they determine it may be useful. Talk about this as a public policy in the bill.
I mean, as a public policy, that's a free-for-all. You're putting so much, anybody who is a doctor, you're allowing them to essentially legalize drugs with anybody that they want. And I bet you 99.9% of the doctors will not recommend marijuana for anything for anyone, but there will be those that do. And if you want to hear a really crazy stat, we know that about 95% of all medical marijuana recommendations in states that have the law are recommended by basically 0.1% of all physicians. So you have a handful, you have 4 or 5, maybe 3 or 4, sometimes 2, that are recommending 99% of, because most doctors, I mean, they're smart. They've been to medical school. They know what the science is. They look at this and say, this is not medicine. We have other things that can be helpful. This can make things worse. They don't, but you're always going to have the rogue doctor or two that is going to have no problem doing this. And I was also very concerned that you were going to be moving the regulatory program of this from the pharmacy board to the Department of Commerce.
That question just came in,
Yeah. Well, I was okay, good, because I was reading about the proposed law, and I'm very concerned about that, because if you really want to make this a medicine, if this is really about sick people, which again I question, because most people are not sick who are using this, so but let's just take that premise on face value, even though it's highly questionable. Why would you want to take it from the Board of Pharmacy to the department that regulates trade and business, unless you are really ramping up for full legalization? So I almost respect people, even if I disagree with them more, who say, put their cards on the table and say, Kevin, I disagree with you. I think we should legalize marijuana and this is how we should do it. I mean, that's more respectable to me than someone trying to, kind of trick everybody in the legislature by saying that they're going to, they're not in favor of legalization. This isn't really about that. But when they write things like this, it is clearly about that.
Thank you. Well, are there any, I see our next presenter is on. Are there any other questions for Kevin?
Oh, there was a question here about social media, I see.
Okay. So right now in the bill, Kevin, it's the Board of Pharmacy has to approve all of the advertisements for the medical program. In this 261 bill, they are asking that one be taken from the Board of Pharmacy into the Commerce Department, but also that they don't have to have any approvals on the advertising.
Well, good luck on all of that, because the reality is it's very difficult to regulate advertising, both because of the free speech, and also because of just the fact that they are, there are so many ads. In fact, I just Googled Ohio medical marijuana advertising, and maybe you can tell me, and I don't mean this in jest, let me show my screen. I literally Googled it. The first thing that came up on Instagram was this: spring break. Here we go. So spring. So I guess this is meant for spring break for teachers, not for kids. I don't know. The awards, the kind of advertising that's happening, the cartoon character. I mean, this was just from Googling it once, showing a doctor. I doubt this is a real doctor. Medical marijuana, showing a cop. Folks, this is out of control. There is no average regulation going on now, let alone, if this gets even looser. And it's not a knock on the pharmacy board. It's the fact that we cannot keep up. Nobody can keep up. That's right. With the violations that are going on advertising.
Thank you. Thank you so much. I would ask you to speak to the social justice element of this here in a minute. Thank you for sending Will down. I think we had 7 different meetings with Will going through the General Assembly, but I do see Representative Holmes has his hand up. Please go ahead with your question.
Yep, thank you very much. I appreciate, Kevin, great brief. I just wanted to ask you, we've been following Colorado too. Are you seeing any movement politically across the nation to push back on in states where it's already legal?
Yeah, that's a great question. Thank you. That's one. I'm so glad you asked. And I know Dr. Finn, my good friend Ken, I'm so glad he's on now, can also answer that during his presentation, but I'll give you my sort of elevator speech on it. The answer is yes. We already know that South Dakota and Virginia have reversed legalization, and we're hoping to get more states that do that. In Colorado, we've been working on a THC cap. It's very difficult. It's taken 10 years. And it's very slow, and God knows what's going to end up happening, but we've been getting momentum on putting a cap, because there's all these mothers, I hate to say it, with dead kids, of kids who got a medical marijuana license and when they were 18 for a headache, and then 3 years later died by suicide. And in their suicide notes, it talks about marijuana. I mean, this is it. You can't make this stuff up. And so because of these angry moms, who frankly are putting a lot of pressure on the politicians now, because of that, there has been a move now to lower the THC, not increase it like you all are talking about, but lower it to a 15% cap, lower it to other levels, restrict what we can on advertising and targeting kids. So there is a movement to do that. Yes.
Okay, now
you want me to talk about social justice briefly? I was going to show a video.
Please.
Okay, so if you go to the site that I showed you earlier, you have marijuana and social. I thought you should hear from the former mayor of Denver, who was there when they medicalized it and then legalized it. I don't know if you've all seen this, but actually, let me just make sure that you can hear. Hold on, it's not on yet. Just want to make sure you can hear the sound. So let me just do this. Share sound, optimize. There you go. This is here. Okay. Let's see here. Are you able to hear this? Or no?
No.
Okay. If you go to the website, which I'll put in the chat because there might be something with the audio. I do want you could see the videos there, but yeah, this is always about targeting people of color, targeting people with fewer means. We know where the pot shops are going to be congregating. They congregate in the poorer areas, and that's something I'm very, very concerned about.
Yeah, me as well. When they say regulate marijuana like alcohol, I know everybody's taking field trips up to Northeast Ohio to look at this awesome marijuana grow and all of that, but really what this boils down to is deregulating marijuana so that the white dope dealers can compete with the black market dope dealers. And all you got to do is go just 5 minutes down the road from the State House and see what alcohol and tobacco industries have done in our inner cities, disadvantaged communities. When they're talking about having more pot shops and green man shops than Starbucks and McDonald's combined, most of those will be in urban environments, low-income environments, and we've already seen from Kevin's presentation the impacts that will have on crime and addiction in those communities over time. Listen, thank you so much, Kevin. Man, you've really helped a lot of us. I know I could probably connect anybody in the GA or governor's office that has further questions. Would you be open for
Of course.
Okay, I thought you'd
Absolutely.
say that. Thank you so much.
Thank you all. Please be, you can get in touch with me. I will send my email here. If you have any further questions, you're in for a treat with Ken Finn right now. And I really appreciate you all coming to here today. Thank you.
Thank you,
Good
sir.
seeing you, Kevin.
We
Thanks. Good
have
seeing you,
with
Ken.
us
Thanks.
Dr. Ken Finn, president of the American Board of Pain Medicine and veteran, I believe 28-year veteran pain management physician. Man, been very helpful to me in my research and trying to communicate and answer some of these questions that the members have had. Thank you so much for making time. You can present. I'll give you the floor here.
Oh, thank you so much for the opportunity. Little background on myself. I'm a pain medicine physician. I've been practicing here in Colorado for 28 years. I served on the governor's task force for Amendment 64 in 2012 when they legalized marijuana for recreational purposes on the Consumer Safety and Social Issues Work Group. I served 4 years on our state's Medical Marijuana Scientific Advisory Council. I am the president of the American Board of Pain Medicine, and I've been on their exam council for over 20 years, writing test questions for doctors who actually want to take care of patients with pain disorders. It kind of prompted me to edit a medical textbook, Cannabis and Medicine, an evidence-based approach, where I had 70 authors from 4 countries covering a variety of impacts on cannabis. And then I'm the co-vice president of a nonprofit called ISAC, which is the International Association on the Science and Impacts of Cannabis. We have nearly weekly speakers from around the world talking about their experience and their research on the impacts of cannabis in a variety of medical conditions. As a pain medicine doctor, over time, I have a lot of very open conversations with my patients on what are they using, why are they using, is it helping, is it not helping? And it prompted me to become a registered medical marijuana patient in the state of Colorado. Disclosure, I don't use, but I was curious to see what the process involved. And I was approved in 60 seconds as a medical marijuana patient here in Colorado that we've had medical for over 20 years. And I was approved in a minute with no request to review medical records. I didn't make anything up. I was a very active young person and played collegiate soccer at Villanova, blew my knees out. I've had multiple knee surgeries. My ortho said I need both knees replaced, and I told them to go stuff it because I'm not there yet. But no request to review MRI reports, no request to review orthopedic consultations, never even asked me my level of pain, which on a day-to-day basis runs about a 0 to 1, maybe a 2 on a scale of 0 to 10, yet I was approved for severe pain. I just got my renewal a couple of months ago, and it took a matter of a couple of minutes of complete silence, some typing on the hand, on the part of the recommending physician. And within a couple of minutes, I was, there you go, was exactly the words of the doctor. I was approved for another year of medical marijuana with really no bona fide doctor-patient relationship. I stayed online with the doctor and I asked her some pointed questions about, what happens if I have an adverse event? What if I have chest pain or palpitations or paranoia? Can I call you? And was clearly directed away from the recommending doctor to my primary care physician. I also asked her questions about potency. And I, because we are pushing for a potency cap, and I can cover a little more of the science of psychosis and related and schizophrenia that's related to higher potency products. And the response by the doctor here in Colorado was, I can use as strong of a product as I wish, as long as I, quote, felt fine. So, maybe I feel fine after 6 beers and get behind the wheel of a car. So there's really some problems in our, as well as other states' medical marijuana programs, which is allowing medicinalization of recreational use. And there's a lot of data to support that, which is actually doing a disservice to patients that may actually benefit from it when you look at a scientific perspective. So can I screen share? Do I have that capacity?
Yes. Yes, you do.
There's a lot of stuff I can cover, and I'm going to try to cover as much as I can in a short amount of time and kind of hit the highlights. This is a presentation. I'm heading to the great state of Texas, where I went to medical school and undergraduate, where I finished my undergrad. I'm speaking to the Texas Medical Association tomorrow morning on this particular issue, and I believe they have the largest, even more than California, state medical association, and they're actually very, very involved from a state, from a political perspective. But I want to just kind of go through some of the disclosures. I do get some honorary for speaking occasionally. I get royalties for my book. I can tell you, if anybody's published anything, I am not going to retire off of this. It's very marginal, if anything. But I want to cover some of the very quick basic science. Can you tell me how much time do I have before I open up the Q&A? Because I want to cover a lot of stuff.
So the call is over at 2:30. And so you can use that time in any way you can. We do have questions that they're putting in the chat. And so we'll be kind of cataloging those, but just go ahead and do what you got to do.
And I did come in kind of at the tail end of Kevin's discussion. And I can tell you here in Colorado, he did mention, and we do have the data to support, there was about 4 or 5 doctors, pardon me, last year that made between 5,000 and 7,000 medical marijuana recommendations alone each. So we have a very small number of medical doctors writing a tremendous number of medical marijuana recommendations here in the state of Colorado. And if you can do the math, 7,000 recommendations a year, just divide it by 12, divide it by 4, and you can see the number of marijuana recommendations per week. It's kind of the equivalent of the pill mills, so to speak, of Florida and other states when we started ramping up the opioid epidemic. But here's what's that?
And Ohio,
and Ohio, yep,
yeah.
For sure. And I can tell you here in Colorado, we had what are called unintended consequences. I mean, after we kind of opened the genie's bottle, things started happening. We're like, we had no idea this was going to happen. And I do a lot of work in other states that are going down this pathway. And I tell the state leaders, I said, we had unintended consequences. If you continue down this road, you cannot claim ignorance. You cannot say, well, we didn't know that we were going to see children ending up in the emergency room, or poison control, or adolescent addiction, or impaired driving, or worsening of our drug epidemic. You cannot claim ignorance. These are now intended consequences to just simply another addiction for profit industry. I mean, the legal drugs we already have, alcohol and tobacco, which do make a lot of money for the respective industries, but we surely know what the societal costs are those. And here in Colorado Springs, we're the second largest city in the state, and we don't have recreational marijuana. Most people don't really understand that when we voted on Amendment 64, 72% of the municipalities said, well, we don't want it in our backyard. Yes, the vote of the people, but we don't want it here. So here's some of the molecules, and they look very similar. You know, which ones are THC, which one's CBD, which one's a synthetic, but there's your answer. And if anybody's worked in a pain clinic, this is sometimes how you feel at the end of the day or end of the week. It's a very challenging patient population to contend with. This is a very important slide to understand the difference between what's cannabis-based medication and what's medical cannabis, because they're different. Cannabis-based medications are registered extracts. They have very standardized dosing. They could be cannabis-derived. I mean, we've had dronabinol since the mid-'80s, which was FDA approved for chemotherapy-associated nausea and vomiting, and cachexia or weight loss associated with HIV and AIDS. I've never had a patient ask me for THC in that formulation. We have Epidiolex, which is purified CBD. And actually two of my authors from University of Alabama, Birmingham, wrote my seizure chapter. They were the ones that fast-tracked Epidiolex through the FDA for these terrible pediatric seizures. Sativex is a natural CBD THC that's not available in the US, but has been the one most commonly studied outside for perhaps MS-related spasticity. Medical cannabis, on the other hand, is just stuff from the plants, the buds, the leaves, the extracts. They're terribly regulated, poorly tested for contaminants. Why do people go to the doctor? You know, I've been following the National Ambulatory Care Survey. It's a huge data point, but generally, you know, hypertension, asthma, obesity, et cetera. But in the top 20 reasons why people go to their doctor, knee pain is the only pain diagnosis in the top 20 reasons. The other things like back pain, neck pain, headache, cancer, seizure are not in the most common reasons people see their doctor. I don't really want to get into the too sciencey part of cannabis and opioids and why there's this very, very tight relationship. They're found in the same area of the nerve endings. They co-localize in the nerve endings that modulate pain pathways. They actually share pharmacologic profiles, which do include something called anti-nociception or pain relief. So from a scientific perspective, there's something there. And by the end of my talk, I may sound like a nihilist, but I'm really not. But other things like sedation and naloxone, which is the antidote for opioid overdose, has been shown to have an impact on the cannabinoid system in many animal models. But this was a nice review. It was like, why are people using for pain cannabis? They used it for pain, by far the most common reason. We're in the middle of an opioid epidemic. You know, going back in time, looking at some of the articles showing, hey, look, states, you know, here's the National Academy's paper saying there's evidence that cannabis is an effective treatment for chronic pain. If you look at the devil in the details of this, they didn't look at dispensary cannabis or medical cannabis. They looked at things that we don't have available, the nabiximols or Sativex, and with synthetics. They didn't look at stuff people are actually using in the dispensaries. Bachhuber's paper showing, hey, lower state opioid overdoses in medical cannabis states, lower prescribing in a very select patient population. So this is where the bandwagon and the platform to legalize is that's going to help our drug problem. But as the data continues to pile up, more data is coming out saying there's no evidence that it's reducing pain. There's no evidence that shows an opioid sparing effect. And actually, Chelsea Shover and Keith Humphreys from Stanford, who I actually was on a Zoom conference with Stanford University before I jumped on here. But the folks from Stanford showed that medical cannabis law passing showed a 23% increase in overdose deaths. And as we go on through the literature, there's more that it's not an effective pain reliever. It's not substituting opioids. Earlier this year, no protective relationship between state medical cannabis laws and opioid overdoses. That kind of counters the claims that if we legalize marijuana, our drug overdoses are going to go down. There was another paper about getting a medical marijuana card. You know, I'm a medical marijuana patient by definition, actually show a higher incidence of cannabis use disorder, and there was no significant improvement in pain. Looking at the Youth Risk Behavior Survey, and again, I want to underscore this relationship between cannabinoids and opioids. The number one risk factor for an adolescent to misuse opioids was lifetime use of marijuana, having ever used marijuana. The JAMA Pediatric article from a couple of years ago, after 3 years of first trying marijuana compared to opioids in the younger patient population, or the younger population, 12 to 17-year-olds, marijuana actually had twice the percentage of addiction in adolescents than opioids. I found that very, very surprising, and the link is there. Wadaker from the Midwest actually looked at a very complex matrix. And, you know, what about adults that may be misusing their opioids? The predominant predictor was having used marijuana before the age of 18. And he looked at all other things. He looked at illicit substances, tobacco, et cetera. But the predominant predictor of adult opioid misuse was using marijuana before 18. Olson's article showed cannabis use increases the risk of opioid use disorder or opioid misuse. Drivers testing positive for marijuana were more likely to test positive for prescription opioids. So again, highlighting this relationship and this link between opioids and cannabinoids. This was a very interesting paper showing that medical marijuana users actually use medically 20% of the time, but recreationally 80% of the time. So again, medicinalizing recreational use. And it was a very well, I think, pretty decent study. These are some of the national and international pain organizations: the International Association for the Study of Pain, the Australian and New Zealand College of Anesthetists, their pain medicine faculty. They scoured the medical literature, and they came up, actually the IASP actually has 11 articles written by dozens and dozens of well-known researchers and scientists in the field, and basically concluded there's no high quality clinical evidence. They don't endorse the use of cannabis or cannabinoids for pain. New Zealand and Australia, same thing. These are some of the societies that don't endorse its use for pain: New Zealand Pain Society, British Pain Society, and this is even including neuropathic pain or chronic non-malignant pain, and even cancer pain, because these studies are poorly done. They're not very well done. They have high risk of bias, et cetera. The Urine Pain Federation, I think I like their paper the best because it's a little softer, so to speak. But we already have a black box warning on the use of opioids and benzodiazepines, and they say, well, don't even give people cannabis-based medications that are on opioids or benzodiazepines, which is kind of a position that I have in my own personal medical practice. They also recommend not using anything higher than 12.5 THC, which doesn't exist here in Colorado. I mean, the average smoked flower is about 20%. We've got extracts averaging 50%, and you get into the dabs, waxes, and shatters of the world, which are available in medical dispensaries that are 90% plus THC. Out of the UK, they don't even offer the synthetics, the nabalones or nabanols, the combination of CBD with THC. They say if you're going to use CBD, it needs to be part of a clinical trial. Colorado Medical Society, Texas Medical Association. Here's some of the data on the deaths. 106,000 people died last year. This is more of a graphic looking at what happened in Colorado. Here's the state of Colorado. I live in El Paso County, kind of central in the graphic, about an hour south of Denver. The darker the color, the worse drug overdoses there are, or the higher death rate. And again, the platform to legalize is that it's going to help our drug problem. 90% of the medical marijuana recommendations in the state of Colorado are for pain, me included. But here's 2002, 5, 8, 11, and 14. It's simply gotten worse. Interestingly, they're like, well, look at the number of prescriptions continue to decline. So we're prescribing less because we're trying to do a better job managing patients in pain on opioids, but the deaths continue to rise. Here's our graphic over time. Again, we voted on Amendment 20 in 2000 and implemented in 2001. And then we had de facto legalization in 2009 when the dispensaries popped up all over the state. We voted for recreational in 12, implemented in 14. And you can see our drug overdoses have gone up. And here's the 2020 data. It looks like the COVID curve. I mean, we've had a significant increase in drug overdoses. Interestingly, heroin is going down. As cheap as it is and readily available, I think fentanyl is the new heroin in my mind. And I have the provisional 21 data, and we've gone from nearly 800 fentanyl or any opioid overdoses in 2020, and we've had a 40% increase. Nearly 1,200 people will be on that blue line. So if anybody, my Zoomies out there, if anybody can tell me where expanding our marijuana programs has helped our drug problem, please send me an email or explain it to me. And we're seeing this in other states: Ohio, California, Washington, Florida, et cetera. I just published a paper. I'm more than happy to put the link in there. I was a contributing author. One reason to expect marijuana is to help reduce opioid dependency and death, but opioid deaths continue increasing where marijuana was legalized, included the fentanyl subgroup. So more states are legalizing. And I find this very interesting. I just showed you the data that more states are, we're having a national opioid overdose problem. There's more people dying, and that correlates strongly with more states legalizing for both medical and recreational purposes. During the pandemic, here in Colorado, marijuana businesses were essential. And you can look on the left, on the right were the states that allowed marijuana to be essential, but on the left, those states that had more than a 20% increase in drug overdoses, there's a pretty significant overlap in those states that had worse overdoses compared to states that either A, didn't have marijuana programs or did not allow marijuana businesses to be essential. I mean, I think it is multifactorial. I mean, drug treatment programs were shut down, recovery centers were shut down, et cetera. So these people really had no place to go to get treatment or care. Just a quick summary, there's no evidence supporting the use of dispensary cannabis for chronic non-cancer pain, no evidence substituting opioids with dispensary cannabis. Although the science, looking at the cannabis-based medications, there might be something there. Cannabis users are more likely to develop opioid use disorder, misuse their opioids, have more psychiatric effects. States with medical marijuana programs typically have higher overdose deaths than non-medical marijuana states. So any real benefit or perceived benefit is certainly outweighed by the current evidence. I want to shift gears and cover a couple of other things. So I apologize if I'm going through these slides too quickly, but I want to get to one of the things that bothers me more is the adolescents. Here in Colorado, we've seen a significant rise in pediatric poisonings. These are the 0 to 5 age group. And again, nobody, I believe, supports allowing access to children. And there were supposed to be things in place, guardrails in place to protect children. But you can see over time in 2012, when we voted to legalize and implemented in 2014, we have had a significant increase in children presenting. These are Poison Control Center data. And the problem I have is here in Colorado and other states, children that are presenting to the hospital with accidental ingestion or marijuana poisonings, those children are not reported to the Poison Control Center at all. These are just the phone calls that they're fielding. A lot of these children are showing up in emergency rooms. Poison Control doesn't hear about them. 4% of these kids end up on a ventilator. They metabolize very differently. Here,
if I can jump in right there, Dr. Finn. We just yesterday, and we sent this out as an attachment with the reminder email today. Just yesterday, the dispatch reported that Upper Arlington, community not too far from the State House, Upper Arlington dad charged after daughter and 4 classmates sickened by his THC gummies. This is kind of what I've been trying to scream from the rooftops, is that, we're talking about 70, 90% THC. Whenever we're talking about marijuana, there's a lot of giggles, back in our college days, or that's not what we're dealing with. We're dealing with very dangerous levels of THC, and the marketing of these products look very attractive to children. And so I just wanted to kind of reiterate that what you're seeing nationally, we've already begun to see here in the state of Ohio.
Yep. And it's happening in all these other states. Ohio and Colorado are not exceptions to the rule. There are no exceptions to the rule. Here in the adolescent population, Sam Wang, who was one of my authors as well, he's a pediatrician, emergency room specialist, looking at adolescent presentations to the ER over time. And this is just on the cusp of legalization. I can tell you it's simply gotten worse since then. But you can see with medical and then subsequent legalization, the number of adolescents presenting to the hospital have gone up, with 70% of them there for psychiatric events. So you're talking about suicidality, depression, psychosis, et cetera. Here's an example of what we're finding in our emergency rooms, although this is probably an illegal product. This is a 12 and 14-year-old. I mean, being on the governor's task force, there's some serious mislabeling here. I think Kevin was talking about social media, but that's how kids are dealing drugs these days, on Snapchat, because it supposedly goes away. This 12 and 14-year-old split this candy that's attractive to young people with reportedly 500 milligrams of THC on the front, 420 on the back. I don't know if it was just kind of a reference to the 420 holiday. So question is, what's in this product? We have absolutely no idea, but they did present to the ER with side effects related to whatever product it was they were consuming. Here in Colorado, I find this very frightening data. The cannabis industry has way more employees than our liquor enforcement division. But the number of compliance checks compared to the liquor enforcement to marijuana enforcement were significantly lower. The marijuana enforcement only did 80 underage compliance checks with more employees, 25 with a significant number of employees compared to the liquor board. They did 2,400 checks for underage. So what are they doing? I have no idea. The Healthy Kids Survey that comes out every other year, we should be getting the one this summer. We've had a 70% increase in kids vaping marijuana in 2 years. That's a significant increase. Kids are reporting they're driving after using marijuana from 9% in 2017 to nearly a third in 2019. Kids are getting it from adults. This is the JAMA Pediatrics talking about the young 12 to 17-year-olds that shows marijuana is more addictive than opioids. Here's the graphic. You can see if you look at the 12 to 17-year-old, it's about similar addiction rate, about 11% for both. But 3 years later, it's 20% in those younger ones compared to 10% for opioids in that same patient population. So delay of onset of use is probably the best for their brains. Self-harm and mortality. Cannabis use disorder is a common comorbidity and risk marker for self-harm and death. I already mentioned that cannabis use increases the risk of opioid use. We know there's a relationship between cannabis use and mental illness. Here's the one, linking the cannabis use and depression, suicidality. Here's this progression from we know there's a direct link between cannabis use and suicidality, but this may be an indirect pathway with adolescents using cannabis, going to opioid misuse, and then suicidality. And here, marijuana is the most prevalent substance found in completed teen suicide in Colorado. Never used to be that way. Interestingly, it correlates when we voted, probably not causal, but we have seen an increase in the number of completed teen suicides in our state where marijuana is the number one substance. It used to be alcohol, followed by marijuana, but now marijuana is the number one. It's gone up every year. I do a lot of presenting in different states, and I can tell you some states don't even test this. They're not even looking at this because it's supposedly safe and whatever. And on the left-hand side, you can see that a lot of these kids are having mental health issues. And, I do a lot of work in schools, and I ask them what's their number one problem in schools these days, and expecting to hear drugs and alcohol, but the number one reason is our kids are dealing with mental health issues for sure. And this is a bi-directional relationship or a chicken and egg argument. Are they using because they're depressed, or are they depressed because they're using? We really don't know. Here, I have these patients of mine. Here's a young man who works as a respite therapist at an autism center. So he's working with autistic children, and he says that he uses recreational marijuana every hour of every day, and he's carting these kids around. CBD's everywhere. Product integrity is one of my platforms, and I won't bore you with a lot of the details because I do want to open it up to questions, and I'm happy to share these slides. This was a very good study out of Massachusetts, looking at emergency room patients presenting that are saying, and I'm going to go through the slide a little slower. I mean, I'm from New York. I know I can get a little pressured speech, but here's patients that are saying, I'm using a CBD dominant or a CBD THC equal product. They had no detectable CBD in a third of those products. And THC was detected in 80% in the patients reporting they were using CBD dominant products. In those that said they were using THC dominant or equal CBD THC products, they couldn't find THC metabolites in 11% of the THC dominant and a third of the combination, respectively. And here's a patient of mine, a kind of a middle-aged woman who said she tried CBD oil and got suicidal. Well, if you go to the Epidiolex website, and I would encourage everybody to do so, and you look at warnings and precautions, and Epidiolex is purified CBD, FDA approved for a narrow spectrum of pediatric seizure. If you look at the warnings and precautions, number one is liver damage, and number two is suicidal behavior and ideation. So even though it may not get you high or stoned, it's not psychoactive, it certainly carries its own baggage in terms of potential side effects. And I don't know what Ohio's rules are on isomerization. I mean, here in Colorado, we banned them a few years ago, so apparently they're not supposed to be allowed. And this is thanks to the Farm Bill. I know Ohio is very rural, has a lot of agriculture, but all of these products are manufactured from hemp. So they're mass producing CBD from hemp, and through chemical reactions create what are called isomers. They have the same molecular formula. You can see at the bottom, the delta 9 and the delta 8, and CBD is also the same molecular formula, but they create delta 8 THC, which is kind of weed light. So it's not as potent as delta 9, but take enough of it, you're still going to get effects and maybe a poisoning. You have these acetylated products, THCO, which was actually weaponized by the US military in the 40s as a potential chemical warfare agent. It eroded dogs' muscle coordination twice as much as conventional Delta-9. And this comes from federally legal hemp. Here's just some of the websites. CBD is actually a precursor to THC in electronic cigarettes. You know, depending on the temperature, the THC products were the main things that they found as a product of heating CBD. And I would encourage you, and I can share this as well at Isaac. Again, we have nearly weekly presentations, and the gentleman that presented from, he's actually from Houston, he's an engineer, did a very, very good presentation on what happens when you combust hydrocarbons like THC or CBD, because that's what they are. These products are insidious. So here's a Charlotte's hemp product sold in Colorado. They're pretty expensive. There's nothing on the label. I don't know how much CBD is in this or how much THC is in this. And again, it's supposed to be 0.3% by dry weight. And that's a very, very important concept, because that's all I hear is the 0.3%. But when you reconstitute it in avocado oil or sesame oil, what have you, it's 10 times stronger. So it's actually 3%. But there's nothing on the label here. And I have the certificate of analysis. So this is about the equivalent of a capful of NyQuil that has a fair amount of THC in it, 84 milligrams. And again, there's nothing on the label about how much THC is in here, because it's hemp. It's only supposed to be 0.3%, but if you do the math, it's 3.0% here. The industry is failing. I mean, Oregon has had a very robust medical and recreational program for years. So they audited their program. I've been trying to ask Colorado to do it. They just won't. They only expected 3% of stores and a third of growers for compliance. And they concluded that we can't even guarantee our test results are valid. We can't confirm that the products are safe for human consumption. California is an 18% fail rate. We don't test or recall regularly. Here's a national recall of sildenafil or Viagra in product. I don't know if this is like a stone and bone type product, but you know, if you have an undeclared ingredient in there that can lower your blood pressure, and you have a person that might have blood pressure issues and maybe on an antihypertensive, well, what is this going to do to that person? Florida has recalls. Here we have arsenic in our products and cadmium in our products. And just a couple months ago, yeast and mold. And if you heat some of those things called mycotoxins can be released. Those products are long consumed. California's recalling. Here's the lab director in Nevada who's faking the data, inflating his THC levels. They were pesticides, microtoxins, heavy metals, microbials, and they put it through and test it 5 times before we quote pass. They'd inflate their THC levels so they get more money. And a few other medical impacts. One of my authors, Robert Page, is a pharmacist in Denver, who was one of my authors and did the drug-drug interaction chapter. He actually was the lead author on the American Heart Association paper showing that when you activate these cannabinoid receptors, you may be at risk for heart attack, stroke, arrhythmia, and sudden death. Here's a paper that came out just recently about long-term cannabis users had a drop in IQ about 5.5 points. They have poor learning, processing speed, and they kind of looked at other things and confounding factors, but clearly there's an impact on the brain because that's the target organ. I mean, alcohol, the target organ is the liver, smoking, the target organ is the lung, but certainly in cannabis world, the target organ is the brain. And that's why we want to protect your young people that might be more vulnerable to addiction. In the state of Texas, when there's a dead child as a result of abuse or neglect, what substance is most commonly associated with the perpetrator? And I like this graphic because it's very apparent that marijuana is the most common substance found by perpetrator when there's a dead child in the state of Texas from abuse and neglect, followed by number 2, nothing, followed by we don't really know, followed by the usual suspects like alcohol and cocaine and meth, and opioids way at the bottom. Cannabis has the highest conversion rate to bipolar and psychosis compared to other substances, including alcohol. And one of my psychiatric colleagues had mentioned that I asked her, I said, well, what scares you the most? I mean, in terms of psychosis, is it the methamphetamine users, cocaine? She said, by far, cannabis psychosis is the scariest because they are the most violent. There's a causal relationship between using a cannabis and psychosis. this is Big Tobacco 2.0. I know there's some state leaders, and thank you for attending this, but here in Colorado, 48% of the lobbyists didn't even disclose their funders' cannabis affiliation, and cannabis organizations used strategies that may have obscured the true amount and source of funding. And tobacco companies like Altria, Imperial Brands, British American Tobacco have all made significant impact investments in cannabis, which is a long anticipated development. Why would tobacco, which we know hasn't been panned out to be very good, invest so much money in cannabis? And I just want to go through some of these slides quickly, just for illustration. These are home grows. Home grows are really a breeding ground for the black market. Here in Colorado, we're allowed to grow 6 plants medically, 12 plants recreationally, but I count more than that here. Why are they wearing hazmat suits and rebreather masks? Because, well, they don't know what's on the plants. They use an antifungal called mycobutanol on some of these plants. And what happens when you heat it, mycobutanol, well, it turns into cyanide, which isn't good for you. There are elaborate electrical grids inside residential homes. There's altered electrical. There's tripping hazards, entanglements for first responders. Commercial grade grow lights in homes. They're do-it-yourself ventilation. They're poking holes in homes. These are some of the 6 or 12 plants here. Mold oozing out of the house, and drywall is not a good medium to grow crops. I like this Google imagery from Mount Shasta subdivision in Northern California in 2017, and in 2021, all those white dots represent some sort of grow, either hemp or marijuana. They don't know if any of these facilities have building permits or well permits. They are finding people that have well permits illegally selling to the cartels and nationals in the state. They're finding dead animals everywhere, DEA, miles and miles of irrigation tubing, trash, banned pesticides, anticoagulant rodenticides, booby traps, snare wires, animals here in Oregon. They don't even know what to do with all the trash that they're finding in these trespass grows. They're next to high schools, they're next to elementary schools. They don't know if any of these places have permits. The Dolan fire in California was intentionally set by an illegal marijuana grower. So intentionally putting first responders in danger. 1 firefighter died, 14 firefighters were injured or in danger, and cost $62 million. Again, here in Colorado Springs, our local mayor asked me to talk to city council, and they had a finance expert from Colorado College and the Air Force Academy, and they talked about, well, if you put these many stores in this population, you make this much money. And it stopped. And so I got up to the podium and I said, I find it very interesting. You have 2 finance experts here, and not one person, including those on council, could spell P&L. They don't talk about the losses. And again, I mentioned alcohol and tobacco make a ton of money for their respective industry, but we know what the losses are, the societal costs. I mean, I published a paper a few years ago that just one hospital here in Colorado Springs that doesn't have legal marijuana lost $20 million between 2009 and 14 just on the cusp of legalization, just from marijuana-related ER visits. Marijuana is a plant. I mean, from a scientific perspective, I support drug development for cannabinoids using evidence-based guidelines to dose cannabis-based medications. Potency cap is critical. Eliminate home grows or breeding grounds for illegal activity. Monitor public health impact. Publish the environmental impacts. Violent crime. Cannabis is very often a common denominator in a lot of these violent crimes that we're seeing across the country. Keep your kids' brains protected. Discourage smoking and vaping. Discourage use during pregnancy and lactation. I mean, here in Colorado, 70% of the marijuana dispensaries recommend women use during first trimester. I spoke at Mayo Clinic in women's health issues. It's simply not good for the developing brain or exposure in utero, and the problems go intergenerational. So that offspring may have problems from a behavioral perspective that even if that offspring doesn't use, that's passed on to subsequent generations. Test all suicides. Monitor your marijuana-related driving fatalities. And, with COVID, it was like follow the science. In marijuana world, it seems to follow the money. Spell P&L. Look at the losses. What's the impact on your environment? What's the impact on your law enforcement? What's the impact on your drug overdoses, your addiction treatment? One of the centers in Denver that I know the medical director said 97% of the kids at the substance use treatment program are there for cannabis use disorder. not for other things that kids typically will use, like alcohol and other illicits. 97% are there because they can't deal or manage their cannabis habit. So it did prompt me to write a book and found a nonprofit. So I'm going to keep it short and sweet there, and I'll open it to questions.
Outstanding.
I
Thank
know
you.
it's drinking from a fire hose, but I'm grateful for the opportunity.
Listen, I can't tell you how refreshing this has been. I'm so tired of hearing from white collar dope dealers on this subject. You know, and usually the only time I'm hearing folks mentioning any other state besides Ohio with this stuff is because, you know, we got to run to Michigan to buy our marijuana because it's cheaper there. It's so important that, you know, right now, the Attorney General's office said that we are at a 10-year high for opioid deaths, and we need to be hearing more voices other than the industry that's going to be making money off of this policy. I'm gonna go ahead and open it up to questions. If anybody has one, just go ahead and speak up.
They're in shock. No, it's a lot of
Okay.
information. And to be honest with you, this is an abridged version of what my typical presentation would do. I'm happy to come back again, or I can put my email in the chat, or if you want to send the email to those that are attending, if they have specific questions, if they you know, want to ask me any questions, consider me a resource for all things marijuana. And again, I'm approaching this from a public health and safety perspective and a scientific perspective. I'm not like Kevin. I'm not a policy person. I'm a physician. I'm a scientist. And again, the parallels that we're seeing between, you know, tobacco and cannabis and alcohol and opiate, we haven't done a good job with any of the legal drugs we have. And now we're going to add just simply another addiction for profit substance and industry onto what we already know we've done a bad job with.
We do have a question from Sheriff Campbell. Do you have any suggestions to help convince legislators to vote against this bill in the face of extreme pressure from the marijuana industry?
Well, thank God for the men and women in blue. I've got a special place in my heart for them. I do a lot of work with law enforcement, and, you know, just speaking to a law enforcement person, you know, law enforcement, they're getting killed over this plant in many states. I mean, there was a train robbery in Arizona, and the DEA agent was shot and killed over a backpack full of weed that was going from California to somewhere else in the South. In Northern California, the folks that I've worked with have gone to too many wakes and funerals for their comrades that have been killed by trespass growers, et cetera. I really think it's important that you protect your communities, and it's a public health and safety issue. And I'm more than happy to share some of the links on what they're seeing in Northern California with bait dogs and human trafficking issues. They're finding clothes of women that are bloodied, so that they know they're picking them up in Tijuana and they're carting them to Oregon with no passport. They don't speak English. They're living and working in terrible conditions. They're not getting paid. They may get some food. Some are getting raped and killed. I mean, this is happening, and people really have turned a blind eye to this. I mean, the California, I just read, is at a record drought. They need every drop they can get, and my understanding is that they are diverting 16 million gallons a day in Northern California to feed their plants and the trespass grows. So I really think you should do your research, follow the science, you know, and again, from a public health and safety perspective, which is where I'm coming from, monitor your data over time, publish it, and say, what are we doing wrong? Because every state I've worked with says, we'll do it better. And I've not seen one state yet do anything better, and they're running into the same now intended consequences because we had unintended consequences. And I think it's very important that you really educate your colleagues at the state level, because I find it very interesting. I mean, I've been working in several states across the country, Alabama, South Dakota, Ohio, New Jersey. And I've had very good conversation with state leaders, but my state leaders won't call me back. I can't get emails. I can't get, you know, phone calls back. A few of them are starting to speak. And I think you should really see one of our state representative, Judy, I can't say her last name, Amably or something like that. Her son was impacted by cannabis use, high concentrate, high potency marijuana. He's schizophrenic now. And she said it's too late for her son, but you need to protect your kids, because this is not, and like Kevin, I'm going to echo Kevin's sentiment that once you're 18, you don't need parental consent to get your medical marijuana card. And based on my personal experience, very easy to do in a state that's had medical marijuana for 20 years. And then you become the school drug dealer. And you can, we're working on trying to prevent looping. I don't know if you have that provision in your state law about, I can go as a medical marijuana patient, I go from dispensary A and get my 2-ounce allotment, and then B, C, and D. And by the end of the day, I have my 10 ounces plus that I'm not going to consume that. It's in the back of my trunk, and I can sell it to my colleagues or the other students in the class. Because you're 18, it doesn't mean you're graduated from high school. There are some 18-year-olds, they turn 18 in September through the end of the year. So they become a medical marijuana patient unbeknownst to their parents, and then become the school drug dealer, and they're selling to kids and down in elementary school now.
Yeah.
Some of the elementary kids are opening their lunchbox, and it reeks of weed. They have candies inside a used Maggie's Farm container, and they're like, well, why is Johnny sleeping in the afternoon after lunch? Well, they think that mom and dad are self-diagnosing and treating Johnny's ADHD with edibles, and they can't confiscate. So it's really a multifactorial problem. And I appreciate you guys trying to address this head on, for sure.
Thank you, sir. I will. We've got a question. Will all the Ohio legislators be given the presentation directly? Yes, by the end of the day, we will have this entire presentation uploaded to our website with both presentations. PowerPoints will be there as well, and we will send out email to all of your offices by the end of the day where you can find those. I will say, just for, as I've been going from office to office, on the Democrat side, the concern is social justice. That's the number one thing I'm hearing, is that we've got too many people locked up. I know Kevin spoke to that a little bit. I did talk to a sheriff that said, there was 2 houses, there were grow houses, and both of those were confiscated and everything. And I think the guy got 6 months. Talked to another guy, said you get a parking ticket fine, basically, if you've got a suitcase full of marijuana in the state of Ohio. And also, because of hemp being legalized, it's hard to even convict anybody for misdemeanor marijuana, because the testing is so tough. These are all issues that need to be addressed. But on the Republican side, the number one thing I'm hearing is, I'm a complete no vote. This is what they all say: I'm a complete no vote on recreational. But I don't know if they understand that on the medical side, with the expansion of the medical side, you are building out the framework for recreational. And the number one reason for that is because I know someone who's on medical marijuana and is being helped. What would be your answer to them?
From my perspective, it's not a partisan issue. It's a public health and safety issue. And again, as a scientist and physician, this is really taxing an already stressed healthcare system. I mean, we're just kind of emerging from COVID. But, in Southern California, for example, they're seeing 35 to 40 marijuana poisonings a day in the emergency department. You have cannabinoid hyperemesis syndrome. You've got, psychosis. You've got trauma. I mean, the impaired drivers that are getting in wrecks. I really can't, I can send you the link to our paper. I think I sent it earlier about, overdoses impacting marijuana legalizations contributed to our epidemic in all major races and ethnicities, especially in Blacks. So there's something there regarding the social justice that everybody should be concerned about. But at the end of the day, this is not a partisan issue. It's a public health and safety issue. And I think I would recommend that the state leaders get educated by the physicians and the scientists on this, because it may be reason to pause. And I agree with you that, medical marijuana has simply been the entree to legalization. In every single state that has legal weed started with med. And some of them are trying to, like even South Dakota was trying to bypass. They were just in the process of med, and they put, let's just skip over that, and we're going to go for a recreational bill that was shot down. But it's really unfortunate, because that's the progression that most states have gone through. Is we'll do it medically, and they parade the seizing children and the elderly dying from cancer on the news. and we don't see them anymore because they've already served their purpose here in Colorado and other states. And it's a tragedy for some of the parents and the relatives of those particular patients, because I think the industry is really doing a disservice to them.
Yeah, and again, we have other drugs that are approved by the FDA, including Epidiolex, and then a couple of synthetic THC products that are meeting those medical needs in a way that we're supposed to be responsibly meeting those needs. Thank you so much, Dr. Finn. I don't see any other questions. Yes.
David, this is Representative Darrell Kick. Sorry, I'm out working. I'm not watching on Zoom. I called in. I've been listening, but I did have to step away for a few minutes, so I apologize for if I ask this question and you have touched on it. I do apologize, and we'll just go on our day. But one of the things that has frustrated me is, as a foster care parent, we see it a lot in our community as far as the kids we take care of, and not just for the mental health side, which I think is really unknown at this point, what the future will hold with that, but just the rampant use that is in the foster system by kids that need our help. And I didn't know if that was touched on or not. That's been a big thing for me and my wife on why I've been a no the whole time. But I just appreciate any comments. I've talked to our other state legislators on why I'm a no, and that is one of the big reasons. It's not just for your use and you're over 18 and you think you can handle it, but it's just getting down to where it shouldn't be. And I thank you for the time today. This has been great.
Thanks, Representative.
I mean, if you're talking about the foster children and those programs, which are sorely needed, many of these kids are products of drug-using parents. And for an example, the Head Start program in Pueblo, Colorado cannot keep up with this tidal wave of the number of kids that are coming to the school with behavioral problems. And, young children exposures or in utero exposures. The data is showing that those kids that may be exposed to cannabis in utero alone, because, some kids may be exposed to other substances, but the data is showing that cannabis exposure in utero is much more dangerous than other substances. I mean, we're seeing increases in autism rates in medical marijuana states. We're seeing birth defects. We're seeing behavioral problems in particular. There was a very nice study that came out showing that children 9 to 11 years old, so middle childhood, that were exposed to cannabis only based on mother's report, were showing psychotic-like episodes at a young age, at 10 years old. So I'm like, well, okay, let me do a literature search. I mean, are kids exposed to alcohol or cocaine or methamphetamine or heroin? Are they showing psychosis when they hit 10 years old? The answer, I couldn't find anything. But you're having behavior problems, and I mentioned earlier that that's intergenerational. So even if these kids may not use down the road and they have significant problems, significant cognitive difficulties, that is passed on to the subsequent generation, at least in animal models that's being shown. And usually that's followed by human models. And the human models are showing that kids that are exposed in utero or young, by the time they hit young adulthood and adulthood, they are having increased drug-seeking behavior. They're seeing behavioral problems. So I really think that it's important that be addressed and do some of the research. I mean, are these kids with problems? What's their parent history? What is their potential exposure history? Because I would suspect that there's a percentage, not all, but a percentage of them that may have been exposed to cannabis at a young age. I mean, we're seeing kids that are coming to school at the elementary and middle school level hotboxing with their parents. The parents are opening their car door. The kids are falling out of the car like Cheech and Chong and the big smoke ball coming out. Well, we're just vaping. Who knows what they're doing.
I saw that on, we were waiting to get into a restaurant on Easter, little Dodge Charger, and we're like, wow, this is so bad. We had to keep our windows up. And then when they got out, apparently they got text that their seat was ready. A little boy walks out of the car. Unbelievable.
So I'm not making this stuff up. I mean, people say, you gotta be crazy. You can't make this stuff up. We're seeing advertising to kids, and the RAND study shows that kids that are exposed to marijuana advertising are more likely to use. So I think it's paramount that you protect the young community. You need to start the education in elementary school, which is really a sad statement to actually say, but that's where it needs to start. So I hope I answered your question.
I'm thankful that the governor's office just recently put out a grant proposal funding about $5 million to raise the stigma on youth usage of marijuana, but that is nothing compared to what will come in terms of marketing to lower the stigma of marijuana in this state. And I'm so thankful that you addressed that. We have come to the end of our time. Thank you so much for being on this call. I can't tell you how much it means to me personally, as well as an organization here at Center for Christian Virtue. Dr. Finn, thank you so much for speaking into what our policy situation here in the state of Ohio. I also want to thank Dr. Kevin Sabet for being on the call earlier. Again, we will make these, the video as well as both presentations available at ccv.org. You will all receive an email with those links. And I would ask you personally, for me, who's been losing sleep over this thing for the last several months, please share this information with members of the state legislature. Thank you so much for your time, and everybody take care.
Thanks, David. Have a good rest of your week, guys.
You as well.